This video is about hip pain diagnosis. We are going to go over some basic areas of hip pain. We'll be paying attention to both where and when the pain occurs in order to help you diagnose your own problem. Knowing what the problem is can alleviate your worries that, and this is usually the biggest worry, that maybe you need a hip replacement. Well, maybe you don't. Let's start with a pain that is often considered hip pain, but it really isn't. It's actually SI joint or sacroiliac joint problems. So you can imagine that if your hip bone is not in the proper orientation, then that would cause the hip socket to not be properly aligned with respect to the big thigh bone or the femur. You might have pain that you believe is coming from your hip, and the results of the test that I'm going to tell you about in this video might lead you to believe that you have hip arthritis and make you think you might need a hip replacement. This is why I'm going to go over this first. If your hip pain is from your SI, causing the alignment problem with your hip bone, then this can actually be easily remedied by aligning the leg bone in the socket. Just see any physical therapist who knows what is called muscle energy technique, and they can sort it right out. The clue here is that although you're positive for all of the tests for intra-articular or in the joint hip pain, you also have pain here on this spot of your back. You may have pain only when sitting or with bending, lifting, or twisting. Now, not everyone who has SI problems has pain in the actual SI itself. Please keep this in mind when we go over the diagnosis tests. Now for the major actual hip diagnoses. Diagnosis: glute muscle weakness. If it's pretty easy to touch the actual location of your pain and it's about here or here, and also, meaning this also needs to be true in addition to having your pain here, you can't stand on that leg without your posture falling sort of like this, then you may have weakness in some of your gluteal or your butt muscles. If those were your symptoms, you have gluteal muscle weakness. Next diagnosis: tendinitis, bursitis, or IT band syndrome. If your pain is close to the surface, close to and slightly behind the big bump of bone here, and you also have pain when sleeping on that side, and have increased pain after sitting still or laying or sitting with your legs crossed, it may be a tendinitis or bursitis. This can also occur with IT band syndrome. This is another easy fix with physical therapy. If those were your symptoms, you may have tendinitis, bursitis, or IT band syndrome. Next, diagnosis: tendon snapping. Does your hip snap when you move or just with certain movements? No worries. If it doesn't hurt and it only makes noise, it's just a tendon snapping. We might be able to fix it if some alignment is off. If those are your symptoms, you have a tendon snapping. Next, diagnosis: psoas muscle problem. Maybe your pain is here in the front and it snaps, but the snapping is painful. You might have injured your filet mignon. We call it the iliopsoas muscle in humans. Rest and physical therapy are what you need. No surgery for you. If those are your symptoms, you have a psoas muscle problem. Next, diagnosis: hip joint problem. If you have a problem inside of your hip joint itself, your pain will be in a C shape like this, but deep. The pain deep in your groin will get worse the longer you sit. You may prefer to sit with your legs like this. This can be several problems, but all are inside the hip joint itself. If those were your symptoms, you have an intra-articular hip joint problem. Next, diagnosis: femoral acetabular impingement. Do you have pain right off when you start to move your hip? Maybe you walk with short steps or bend forward a little bit to favor your hip. You might have trouble standing on one leg, or trouble lifting your leg to climb stairs, or get in and out of a car, or put on your socks. You could have a bit of extra bone that interferes with your motion. This is called femoroacetabular impingement. This problem can be improved with physical therapy. The treatment may include strengthening of the hip and the core. If left untreated, it can result in further damage, meaning a labral tear or hip arthritis. If these are your symptoms, you have femoral acetabular impingement. We are covering those labral injuries next. So, diagnosis, labrum injury. Let's go back to those of you who have that deep groin pain that gets worse the longer you sit. You might walk a little bit bent over in order to favor your pain. Your hip might also catch, lock, or give way. If this is the case, you might have injured what is called the labrum. It's a gasket type thing that rims the edge of your hip socket. If this is your problem, sometimes it needs surgery, sometimes not. If these are your symptoms, you have a labral injury. Next. Now for the scary one, hip osteoarthritis. This is the one that if you let it get bad, it might mean you need a hip replacement. I'm going to tell you a series of tests. If you're positive for at least 4 of these, then you probably have hip osteoarthritis. So here we go. Number 1, pain with squatting. Number 2, pain on the outside of your hip when you bend it. Number 3, pain when moving your leg behind you or extending the hip like this. Number 4, unable to move your leg like this. This is called internal rotation. Number 5, laying like this causes pain in your groin. And number 6, pain or stiffness that lasts 30 minutes upon waking in the morning that sometimes comes back in the evening or after a lot of activity. If you tested positive, it doesn't mean you need a hip replacement right now. There's a lot that physical therapy can do to decrease or even eliminate your pain, to prevent further deterioration, and keep the surgery something in the distant future. Of course, I like to believe that me and my team of unusual therapists can fix everyone and everything, but here's another list of 5 things. If these 5 things are true for you, then it makes it even more likely that PT can help. Number 1, your pain is only in one hip. Number 2, your symptoms have been going on for about a year or less. Number 3, your pain is less than 6 out of 10, with 0 being nothing, 5 a good solid ache, and 10 severe. Number 4, you're less than 60 years old. And number 5, you can walk 100 feet in less than 30 seconds. That's about the third the length of a football field. But don't fret if this list does not fit you. Physical therapy is often the best solution for hip pain. Try these things out, replay the video, and follow along if you need to be sure of your diagnosis, then call us to schedule an appointment so that you can get your old life back. 703-723-7726. If this video helped you, please like it and share it. If you'd like to see other videos like this, subscribe to our YouTube channel, like us on Facebook, or check out our website. For one-on-one help, call today and make an appointment at 703-723-7726. We have offices in Northern Virginia and Virginia Beach.